human blood group can be determined by the presence of antigens on the surface of red blood cell and the presence of antibody in the serum. To make sure the practical runs smoothly, we have prepared all the apparatus for you. So here we have micropipette with 2 until 20 microliter and micropipette tips, applicator stick, patient sample in EDTA tube, and separated patient plasma. Then we have grouping tile. For direct blood grouping, here we have a commercially prepared anti-sera. So here is anti-A, anti-B, and anti-AB. We have anti-D for rhesus typing and rhesus control. And for indirect blood grouping, we have freshly prepared ABO cell. We are going to perform direct and indirect ABO grouping using tile method. But before that, I'm going to put drop of anti-sera onto the tile. First, anti-A, anti-B, anti-AB, anti-D for rhesus typing, and RH control. For indirect, I will place ABO cell. This one is A cell. B cell. And O cell. So now, using micropipette, we are going to take the sample and put it nicely onto the tile. So just now, I have already pipetted patient red cell for direct grouping. Now, I'm going to pipette patient plasma into the ABO cell column for indirect grouping. So now we are going to mix the antisera and patient sample with the applicator sticks. Make sure that you use new applicator stick each time you mix the sample and the antisera. Now we are going to slowly agitate the tile to make sure that the antisera react with the patient sample.
And now I'm going to bring you to have a closer look at the tile. So we have helped you to run 5 patients for the blood group determination. And let us go through it together to have a look at what might be the possible blood group for patient P, Q, R, S, and T. Now have a closer look here. We have two types of results that we can see. One is the agglutination, results with agglutination, and one is no agglutination. So the agglutination will look like this. The cell is clumping, right? So the negative or no agglutination will look like this. There is no cell clumps. This is agglutination. This is no agglutination. This is agglutination. This is no agglutination. All right, so let us just have a look at the first patient, patient P. This is the direct grouping section where we have your NTA, NTB, and NTAB. NTAB is the mixture of NTA and NTB. In this section, we're going to look at the indirect blood grouping, where we have the A cell, B cell, and O cell. So this ABO cell, we prepare, we get it from a non-blood group patient. A cell is from patient with blood group A. B cell is from patient with a B blood group, and O cell is from a patient with O blood group O. Okay, and then this area is the rhesus typing. So we have the rhesus D, NTD here, and for this section will be your rhesus control. So the rhesus control is to make sure that your test is valid. The rhesus control must always be negative at all time. Let us continue. Have a look at patient P on the direct grouping section. Patient P is reacting to NTA. So that means the patient cell has antigen A. The patient has antigen A on its red blood cell surface. We move to NTB. There is no reaction, no antigen B detected. Again, the NTAB is the mixture of NTA and NTB. It's still showing. To counter check the first section here, the NTA, it still shows agglutination. Okay, so obviously the patient is having antigen A on his red blood cell surface. Then, to confirm, we will proceed to the indirect grouping section. Patient group A will have NTB on their serum. Now, it's confirmed here whereby the serum is reacting to the B cell. There is agglutination there. And then we move to the rhesus typing. The patient is rhesus positive. The NTD is reacting to the patient cell, showing that the patient has D antigen. So patient P is A positive. Then we go to patient Q. Patient Q, NTA, no reaction. NTB, yes, there is a reaction, agglutination. AB, agglutination. Obviously, patient Q is having the B antigen on its red blood cell surface. Now we go to the indirect section. The patient has antibody A in the serum, because you can see here the serum is reacting to the A cell. So the patient group B with the NTA present in the serum. Again, patient Q attributes B antigen on his or her red blood cell surface area and is having NTA in his or her serum. So now, again, the rhesus typing is also positive, the presence of antigen D. So patient Q is B positive. We move to the next patient, patient R. Now this is interesting. You have a look at the direct grouping section here. There is no reaction shown by the NTA, NTB, and NTAB. That means patient R is showing no presence of antigen on his or her red blood cell surface. But when we move to the indirect grouping section, this patient is having NTA and NTB on his or her serum. So what might be the blood group of patient R? There is no antigen on the red cell surface, but the patient has NTA and NTB on the serum. Okay, so the patient R is group O. Group O. Right? Because there is no antigen A, antigen B detected on their red blood cell surface, but they are having the NTA and NTB. As you can see here, the NTA and NTB react to the A cell and the B cell on the indirect section. So patient R is O, alright, showing a positive result here on the rhesus typing. That's when patient is having the the antigen D on its antigen surface. So patient R is O positive. Now we move to patient S. This one is also very interesting. As you can see, it's vice versa than R. Okay. Again, the patient rhesus typing is positive, right? Now we know the patient is rhesus positive. The blood group, the patient is showing reaction on anti-A and anti-B and also anti-AB, meaning that the patient is having A and B antigen, both A and B antigen on his or her red blood cell surface. So that is why our commercial anti-sera, the anti-A, anti-B, and anti-AB is detecting the presence of antigen A and antigen B on the red cell surface. Now we move to the indirect test, blood grouping here, indirect section here. So the patient AB, they don't have the antibody A nor antibody B on their plasma. So they're not showing no reaction here. Okay. So for patient S, the blood group is, yes, A, B positive. Okay. So last but not least, the patient T. Patient T, there is no reaction with anti-A, anti-B, and anti-AB, meaning to say there is no presence of antigen A or B on the surface cell, but they're having the antibody A and antibody B, because you can see it shows agglutination here. There is reaction here, right? But on the rhesus typing, again, you can see the patient also is having a negative reaction with the anti-D. So that means the patient don't carries or don't have the D antigen on their surface cell. So for patient T, the blood group is O, because there is no reaction here, no antigen A and antigen B detected, but there is anti-A and anti-B presence in serum. Okay, but the rhesus typing is negative. So patient T is, yes, O negative.